This is Sven Larson reporting from the Patient Connections Conference, and I'm here with Saverio Rinaldi from Clarity Health Journal. Saverio is from Canada, and he thinks that there aren't as many differences between the Canadian and American health systems as a lot of people believe. Saverio, you want to elaborate on that?
Well, I think one of the biggest challenges is that people have a perception that in Canada we've solved all the problems related to healthcare. We have done a lot in terms of universal healthcare and being able to provide patients with a safe way to get healthcare, as opposed to being a very high-cost healthcare system as it is in the U.S. But when you look at the similarities between the two systems, you're still dealing with people, you're still dealing with doctors, you're still dealing with administration, and all those things are the same in both countries. So a hospital in Canada may get funding for up to 70% of their costs, but 30% of the cost comes from elsewhere. And people in Canada do need private insurance, just as in the U.S. The big difference is that when it comes to essential health care, it's provided all through your life. In the U.S., what we've seen is hospitals still get funded. About 70% of their costs is covered by Medicare and Medicaid, and patients end up paying for the difference, or hospital administration is spent on collecting that 30%, which in most cases they're not going to ever get. So there's a high cost of recovery of that revenue.
So you had also mentioned to me in our conversations that the Ontario provincial government, Ontario, where you're from, their last budget had something like 50% allocated to healthcare costs. How can that sort of model be sustained?
Well, it can't be sustained, and we've seen it in other parts of the world as well. You know, you look at the situation in Greece where the healthcare system is falling apart, not being able to pay for high-cost care because of the economic situation. It's not sustainable to have 50% of your provincial budget, of your country or your state budget, going to healthcare. The only way that we can expect down the road that the healthcare system will be there when we need it is to make sure that people stay healthy and try to improve wellness. So, we heard this morning, rather than healthcare, rather than sick care, we need to focus on the health part of healthcare.
That's a growing trend, a discussion that's coming out of all these conferences. Do you see that movement taking hold and becoming more popular as time goes on?
I think it has to. I mean, we really won't have any choice in the matter. We talked about things like smoking being a big health factor, child obesity being a big health factor. All those factors will increase our long-term healthcare costs. As a society, as a population, we have to work towards keeping people healthy and keeping people out of those high-cost interventions, emergency room visits, problems that can be avoided, so that when you do need that heart transplant, the operation that really will save your life, that the resources and the money is there to make sure that you can survive that procedure.
Great. So I guess the takeaway from this one is even with universal health care, there are still universal problems.
That's true. There's always the challenges of how do you stay healthy, and how do you keep the system healthy so that it'll be there when you need it.
Well, thanks so much for talking with us today, Saverio.
Thank you.
This is Sven Larson from ePatient Connections, Pixels and Pills.